Hello and welcome to Module 2. Today we're going to talk about postural assessment. We're going to go through the three common postures that you may see, come in contact with. We're going to review the tonic and phasic muscles, or the upper and lower cross syndromes, but also going over the point of references when we do our assessment. So this is a little bit more hands-on, and hopefully this video will help you guide through the manual. We're going to have Cassie come on over. Right. Hi, Cassie. Cassie's back. All right, so I'm going to have you turn to the side, Cass. All right, so the three common, besides ideal posture, which will make up the four, the three common postures that we may encounter are, again, the kyphotic lordotic posture, where somebody's rounded forward at the thoracic spine, roll forward shoulders, head forward posture, and a lumbar curve, so an anterior tilt pelvis, and knees bent. Kind of hard to manipulate that. The other posture would be the sway back posture. So the knees typically are hyperextended, the pelvis is posteriorly rotated, and the upper body is swayed back of the pelvis. So the pelvis actually and the hips move forward while the upper body leans back, putting a lot of stress on the low back. That is the term sway back posture. The flat back posture, which is a posteriorly rotated pelvis, the lumbar spine actually flattens out. You can have a little bit of kyphosis with that, and generally the knees are extended. So on the flat back posture and the sway back posture, you'll have a posteriorly rotated pelvis. On the kyphotic lordotic posture, or the lower cross syndrome, you'll have an anteriorly tilted pelvis. So we can visually see this on our clients, or sometimes we have to get a little bit closer to get those assessments done so we can really get a good appreciation where the pelvis is located, how it lines up with the hip, ankle, and knee, and the shoulders also. So we're going to start off with Cassie from this lateral position. So I start off at the pelvis and I work my way down and then go up to the shoulders. We're going to do this lateral view, posterior view, and the interior view. So Cass, I'm just going to have you hold your arms right up here. So on the lateral view, starting with the pelvis, we want to locate the ASIS and the PSIS. All right, so that's something, it's going to take practice to do this, but located, if you check with your manual, you'll find those locations. And the little dimple in the low back here, and right in the front of that little knob. And what you're going to do, you're going to look for whether they're angled down, so that would be anterior tilted, or if the ASIS and the PSIS is angled backwards, or the ASIS is higher than the PSIS, that would be posteriorly tilted pelvis. Now women generally, from a structural standpoint, can be anywhere from 0 to up to 12 to 15 degrees anterior tilt. So again, that's that angle of measurement. So you have to be aware of that. Men are generally straight across, maybe a slight anterior tilt. So we get an appreciation of that motion. So if Cassie goes into an anterior tilt, her position is here. So hopefully you can see that well. That's the angle. That's a steep angle much greater than 15 degrees. If she just relaxes, and that angle is reduced, and it's still anteriorly tilted, but that could be normal for her. Then we go into the lumbar spine just to kind of see if she has a nice gradual curve in which she does. And we're going to go into the hip to explain that a little bit more. From the lateral point, the crest of the ilium, and some people are ticklish, so you have to be careful of this. You find the peak of the apex of the ilium. That line, just like her shirt here, should dissect her trochanter, which is here, coming down through the anterior aspect of the knee, or just anterior to the midline of the knee, and coming down just in front of the malleoli. That line, those joints should be in line, and she is in line, so that's very good. So that's showing that anterior tilt is probably normal for her. Her lumbar curve is within normal ranges. I didn't measure that, but going by the convexity of her curve, it appears to be normal. But the second check that I can do is whether this hip is in extension or flex position. So So again, that's that line we're looking for from the trochanter to the knee to the ankle. Now, if Cassie was in a flex or a hip flex position, bend your knee just a little bit, and she would be anteriorly tilted a little bit more. Good. Now I would measure that line, and her trochanter would fall behind her line of her knee and her ankle. So I know that she's in a hip flex posture. If she was hyperextended, her knees were hyperextended, the knee would fall behind, and of course that's going to be hard for her, but the knee would fall actually posterior of the trochanter. So that would show that the hip was in extension. So we can actually look at our muscles and decide what muscles are overactive and underactive just by that hip position. And we'll cover that in future modules. All right, guys, I'm going to have you turn posterior here. So again, looking at the pelvis here, I'm going to locate the PSIS, and my thumbs should be in line with one another, not elevated or rotated posteriorly or what have you, the rotation. So I'm going to look for that. So 3-dimension. We want them in the frontal plane, we want to make sure that they're level. Okay? If one is higher, then that could be indicative of an elevated ilium. If one is posteriorly rotated compared to the other, then we have a torsional effect of the pelvis, creating rotation at the hip joint here, which would be internal rotation and external rotation of the front of the hip. We'll look at that from an anterior view a little bit more. And again, you can follow that along with in your manual. I will go up to the crest of the ilium here. This is a very important measurement. And we're going to look if they're level in the frontal plane. And Cassie's is pretty level. In the manual, you'll see some other iliums that are elevated. That can be the shortness of the quadratus lumborum or just weakness of the lateral hip musculature. Now go up underneath the 12th rib, and that line again should be horizontal. And if you follow along in the models in the manual, you'll see all those lines and oriented. And you can go through all those different lines with the body, but here's some general ones to start with, the real important ones that will give you a lot of good information. Now we're going to have you go anterior, forward for me, or turn right around for me, anterior. Good. Looking at the pelvis from the front. And have you bring your feet in just a little bit. We're going to back up on that. In the beginning of the module, we talked about the assessment process, starting off with a history and what have you, and then when you do the postural assessment, make sure that we're 3 to 4 inches away from our feet are in line 3 to 4 inches away. So it's very important to get that starting position so you can get accurate measurements. Anterior ASIS, so you're going to find those spots, and again, they should be in line with one another. If one is elevated on this perspective, then we have to look at if it coincides with the lifting of the ilium, or if it's anteriorly rotated or posteriorly tilted compared to the other side. So sometimes you'll get a pelvis that's rotational or has a torsional effect. So say if this ASIS is higher than the left side here, then it could be the pelvis on this side, or the innominate can be rotated posteriorly. That could be indicative of tight hamstring. Or if one side is excessively anteriorly tilted, again, the hip flexor group on the left side can be the cause of that. So we want to look at both. And of course, that will translate to some stress on the low back. Great. Put your hands down. Perfect. And then rotations, again, like I mentioned posteriorly, if you see somebody rotated this way, this could be indicative of tight TFL on the side that's pushed back, anteriorly tilted. When this is in position, this hip joint is actually internally rotated while this one is externally rotated. So we can say the internal rotators may be a little bit excessively tight on this side, while the external rotators may be tight on that side. Generally what I've found is the tightness will actually create this torsional effect, and then of course you'll have abdominal imbalances of the obliques. So again, this start of the postural analysis is getting things in our minds. So we can go later on in different modules and we have different tests. We have tests on the table, we have specific muscle tests and movement tests to confirm all these things. So it's not just based on this one postural assessment to figure out what muscles are weak and which are tight. It gives us an idea and we'll move on from that.